Hi guys, it's Jen from Embrace Dental Hygiene. I just wanted to talk to you a little bit about tooth whitening. I get lots and lots of questions about tooth whitening. Everybody wants whiter teeth. Um, okay, so first thing I'm going to tell you is that teeth aren't meant to be white. They come in shades of yellow and gray, and that's how nature makes them. But somehow we have this idea in our heads that our teeth have to be whiter. And yes, we can make them whiter. There's all kinds of ways to do that. There's all kinds of natural remedies I've seen on the internet. People talk about turmeric, they talk about oil pulling, they talk about using actual peroxide on the teeth, which I don't recommend. If you look at the skull and crossbones, that is not an invitation to take internally. But there are products that out there that do work. There's lots of over-the-counter products available in every shape. There's gels, there's brush-ons, there's pens, there's trays, and some do work. They usually utilize the same ingredient that we use professionally, peroxide of some kind. And if you follow the instructions and avoid stain promoting behaviors like coffee, tea, red wine, you can absolutely get some good results with over-the-counter products. But if you have sensitive teeth, you want to be definitely cautious with whitening. Whitening toothpaste even is not meant to be used every day. Most whitening toothpastes are abrasive. So what that means is it's like using sandpaper on your teeth. So it's removing surface stain mechanically in the same way that we remove it when we do a professional polish. When we do a professional polish, we do what's called a selective polish, meaning we just polish the areas that have stain or biofilm and avoid areas that don't need to be polished, particularly dental work, exposed root surfaces, all of those things. So you don't want to apply a whitening product to any of those areas. And you also want to make sure that you've had recent cleaning and exam, because if you apply peroxide to enamel that is incompetent or decayed, you're going to have a lot of pain and it's going to not be a pretty sight. We don't want to do that. So that's why professional whitening products usually are not dispensed without a consultation, in which we ask you if you've had a recent dental exam and free and clear from decay. And obviously, before we do a professional procedure like LED whitening in office, we're going to ensure that the surfaces we're applying the gel to are intact enamel and healthy enamel, and we're not going to compromise that tooth in any way, shape, or form. I've gotten off track, but basically, whitening, yes, it can absolutely be work and it can be for everyone. We just need to customize it for your specific needs. I do several types of whitening. I do take-home whitening where I fabricate custom trays for your teeth. So you come in and I take impressions. If you've had impressions, I'm sure you love them. And then I will fabricate custom trays for your teeth. And then you go home with those trays and the professional strength gel and instructions on how to use them for 2 to 4 weeks so that you can brighten your teeth. Another way I do whitening is in office LED whitening. I'm using a system right now that I love. It's called Spotent, this one right here. And we utilize, it's a prefabricated tray, not a custom tray, because the product is so gentle. This custom tray, or this prefabricated tray, I use this, we have put the product in the tray and it goes in your mouth. It's attached to our LED light. The LED light is red and blue, and the red is to heal the tissues, the blue is to accelerate it. So you can either do what we call brightening for 10 minutes or whitening, which is a 20-minute to 40-minute procedure, depending on how white you want to go. And it has aloe, neem, xylitol. So all of these things prevent that drying out that causes a sensitivity with most of your traditional whitening. So that's why I love this product. You go home with your trays. These are yours, the case. And you can choose whether you want your 6 month of aftercare product. Whitening is a process that relapses. We don't go home and take these teeth out and put them up on a shelf. We use them. We drink coffee, tea, red wine. We smoke in some occasions. Dark berries, colas, all of these things are going to cause relapse. And the way to control the relapse is with a maintenance product. So this is going to get you longer period before you're going to need or want to do a second LED procedure. Basically, you can add this to your toothpaste. This product is not abrasive. It also contains aloe, neem, xylitol, so it's safe. The manufacturer says you could actually use it every day. I wouldn't use it every day because it does still contain a peroxide product, so you want to give those teeth some time to recover. So you are either going to add this to your toothpaste for a quick touch-up, or you can put it in your tray that you're being provided with for a 30-minute touch-up at home and before an event, and you're good to go. This is equivalent to 30 syringes of professional gel, so it's an amazing value, but you don't need to buy it. Anyways, if you have questions about whitening, tooth sensitivity, anything at all, oral health wise, I'm your girl. Give me a call. EmbraceDentalHygiene.com or 519-736-1100. Thanks for watching.